People with sleep disorders often awake feeling tired, not getting the restorative sleep they need. We spoke with Dr. Stuart Menn at Desert Regional Medical Center in Palm Springs to find that snoring and sleep apnea are just some of the sleep disorders that can negatively affect every aspect of your life.
Sleep disorders come in many forms, many presentations, and affect age groups that vary from young kids to senior citizens. I like to sort of classify all the sleep disorders into the following way. First of all, there are the disorders of initiating or maintaining sleep. It's a fancy way of saying insomnia. People who complain, I have trouble falling asleep, or if I do fall asleep, I have trouble staying asleep, or I'm waking up way too early. It's a very, very common sleep disorder. As a matter of fact, it may be the most frequent sleep disorder, not the frequent sleep disorder that I see as a specialist, but the one that it goes to a family practice doc or to his internist complaining about that. The second area are the disorders of excessive daytime sleepiness. So these are people who don't necessarily complain about how poorly they sleep at night, but they have difficulties staying awake during the day. And one of the most common causes of that is obstructive sleep apnea. The third thing are an interesting group of disorders that are now getting a lot of publicity. And these are strange behaviors in the middle of the night. Now we know about the behaviors of young kids that are quite normal, sleepwalking and sleep talking and night terrors, but these are disorders that are now occurring in adults, in which adults, for example, start to act out their dreams, sometimes in a violent way. And these are called parasomnias. They are unusual behaviors in the middle of the night while people are sleeping. Another hot topic is what's called nocturnal eating disorder, where people actually start to eat and binge while sleeping. It's a form of sleepwalking. It sounds pretty amazing. And then finally we get to the disorders of what we call rhythm disorders, or the circadian rhythm disorders, probably best known by shift work sleep disorder or jet lag, where people are sleeping normally, but they've been shifted out of their normal system. One of the most common things for young kids, we're seeing this a lot in teenagers and in their early 20s, parents complain about it, is these kids can't go to sleep until 1 or 2 o'clock in the morning, and then they want to sleep until 10 or 11 o'clock in the morning, and they can't do that because of their work, and they get into some real difficulties. They are extreme night owls. The other side of the coin are the extreme morning larks. These are people who can't stay awake after 8 o'clock at night, and then they'll wake up at 3 o'clock or 4 o'clock in the morning, and they want to attack the world, and yet the world's not ready, ready for them yet at that early time. So these are the circadian rhythm disorders. And then the last thing, which has gotten a lot of publicity lately because for the first time patients are bringing it to the doctor's attention, is this strange condition called restless leg syndrome, where at night, as a person is ready to go to sleep, they're not asleep yet, but they're getting into bed, they're relaxing. Sometimes it happens while they're still in the living room watching TV. They begin to feel a creepy, crawly, very strange feeling in their legs, very annoying, not extremely painful, but very annoying, in which they get a magical relief by movement. They feel they have to flex their legs, move, they have to get up. You can imagine what happens is every time you're going to sleep, you get these feelings. You have to get out of bed, walk around, it gets better, you get back into bed, it reoccurs again and again. And it's called restless leg syndrome. And thankfully, there are now some medications that have been FDA approved for the relief of this condition.